Neck masses typically that we see at AFCC prenatally based on imaging are divided into two groups. One are the cystic fluid-filled masses that are mostly consistent with lymphatic malformation. The second group, which are less frequent, are the teratomas, which are more solid masses. The main concern and the danger that the neck masses can present at the time of birth is airway compromise. And obviously, depending on the size and the location of the mass, we need to take all the measurement into account as to be sure that the child is safe at the time of delivery from an airway standpoint. And that is determined by the size of the mass, by location of the mass, by extension of the mass into different areas of the head and neck. Typically, the neck masses are picked up on ultrasound during the prenatal evaluation. Then after referral, we'll get further imaging such as MRI. We'll follow the neck masses as far as the size, its growth, its location. And we follow that through the pregnancy. If there is any concern with airway issues, then we'll take that into account of what needs to be done at the time of delivery. Whether it will be a simple delivery, whether it's going to be an C-section, whether we need to be present at the time of delivery, or if there is any concern, then we may even consider the exit procedure. If the mass is away from the airway, let's say it's on the what we call the lateral or completely right or left side of the neck and is away from the airway, then our preference is just to be available at the time of delivery. We will have all the equipment available, but I don't think any specific procedures or change of plan needs to be done. And that would be the best scenario as far as the mom and the baby is concerned. The long-term outcome of the children truly depends on the mass, the nature, the pathology of the mass, and its location. If it's a simple, benign mass, whether it's a lymphatic malformation or teratoma, and it could be excised without compromising any vital organs, then the outcome is excellent. And in our experience, we have been able to manage that in majority of the patients. Obviously, there are some cases that the teratoma or lymphatic malformation may involve vital structures in the oral cavity, in the airway, in the esophagus and eating tube that may have some compromise in the future. And I think at Children's, with all the helps and the facility that is available, we have been able to manage these children well with regard to the long-term issues.